Good morning, all. Today I will speak about the rabies, ARV and the rabies immunoglobulins. As a pediatrician, you must know that even bites in adults also they will call pediatrician to know about the rabies things. So before going into rabies part, we have to know that which animal bite requires rabies prophylaxis treatment. First thing is the we know that dog and cat, along with all mammalian animals around our domestic houses like horse, donkey, pig, monkey, sheep, goat, everything is required. Important is the domestic rat. It's not required any rabies this one. But Pandikoko used to call village one that is required in the ARV and the sometimes rabies immunoglobulins. The main step in the treatment of the rabies immunoglobulins or ARV is the categorization of the wounds. We categorize into category 1, 2, and 3. Category 1 is the licks on a intact skin or feeding animals. This doesn't require any treatment. Category 2, any scratch. It's required in the category 2. It requires treatment of wound care along with ARV. There is a category 3, scratches with bleeding and licks on the oral mucosa or broken skin. Any child with immunocompromised in category 2, any wild animal bite. All are coming into the category 3. They are required wound care, ARV, and rabies immunoglobulins. So the most important point among this is the wound care. So after bite happen, wound should be washed with soap water under running tap around 10 minutes, followed by local application of the powdered iodine. Another important point is that if big wounds, so the bite causes loss of some mass, muscle, or flesh, that should try to avoid suturing as much as possible. If you have to suture for hemostatic control, first immunoglobulins has to be poured into the wound, then try to suture with a blunt needle rather than point needle because more damage in that area, chance of more virus spread. So all of us know that ARV schedule 0, 3, 7, 14, and 28. And coming to the rabies immunoglobulins, there is a monoclonal antibodies, biclonal antibodies, and human rabies immunoglobulins, equine rabies immunoglobulins. Depend upon your availability, the dose you have to be given. Another important point regarding the rabies immunoglobulin, the wound should be covered with the rabies immunoglobulins. So if your wound is too small, so much amount you have to infiltrate around the wound, remaining amount no need to give in the IM. At the same time, multiple wounds are big wounds, the amount is less. What we do? We have to dilute with normal saline. Every wound should be given with rabies immunoglobulins. Some studies reveal that after proper taking of post-exposure prophylaxis immunoglobulins, why they develop rabies means when there are multiple wounds in hidden areas like a groin, like a back, where clothes are covered, that areas are missed by the rabies immunoglobulin infiltration. So you should properly check the all areas and you have to use the rabies immunoglobulins. So same thing. Sometimes what will happen after getting the course again, child has bitten by the another dog or cat. What will you do? After completion of the post-exposure prophylaxis, within 3 months again bite happen. Nothing required. If the bite happen after 3 months, we have to give the only two doses, 0 and 3. And now we are seeing so much discussion between the court and some celebrity people like regarding the rabies dogs, how to do all these things. We have to be what care we have to be taken, what ACB be telling. So in India, everyone is a risk to the exposure to the dog bite. That's why you can get the pre-exposure prophylaxis. This pre-exposure prophylaxis will be the 0, 7, and third dose between 21 and 28. So what advantage we'll get with pre-exposure prophylaxis? If dog bite comes, we have to give only two doses, and there is no need of the rabies immunoglobulin administration. Even bite also happen because already because of pre-exposure prophylaxis, child had the immunoglobulins. Thank you.